Summer, it's the time of year everyone loves to get outside, but for a growing number of people, that has left them very sick with Lyme disease.
I just kept deteriorating with really weird heart palpitations and cognitive issues like unable to concentrate, slurred speech, trouble swallowing.
It all starts with a tick, and those ticks are small, some about the size of a poppy seed, and that means you may not even notice when one bites.
Physicians may ask, well, did you have a tick attached to you? But the vast majority of patients won't recall the tick attachment.
The infection and spread of Lyme disease is actually more complicated than simply being bitten by a tick. An adult female tick takes up residence on an animal host, like a deer. The tick drops off the host and lays its eggs. Those eggs hatch into larvae. Then the larvae find another host, often mice. It's here experts believe the tick acquires the bacteria that causes Lyme, Borrelia burgdorferi. The larvae then molt into nymphs and leave the first host. Sometimes those nymphs end up on a human, where it bites and feeds. The nymph may also find yet another rodent host instead, where it can again pick up the bacteria, giving it yet another chance to infect a host down the line. And adding to all of this, ticks can even hitch a ride on migratory birds, meaning infected ticks can end up anywhere those birds fly.
So there is nowhere that you are free and where we can say there is zero risk of Lyme disease.
Lyme was discovered in the early 1980s after a group of children started getting sick with rheumatoid arthritis-like symptoms in Lyme, Connecticut. Since that time, thousands of new infections have been reported in the United States alone.
Oh, God.
The CDC reports upwards of 30,000 new cases a year, but admits the number is likely much higher, as this only tracks lab-confirmed cases. According to the Lyme Disease Association, that number is actually closer to 400,000 and growing. It's now being found in over 80 countries worldwide, including countries in Asia and Europe. And patients are finding out just how tough it is to diagnose, treat, and live with.
I had seen neurologist after neurologist, neuropsychiatrist, internal medicine specialist. 4 or 5 appointments later, retesting for cancer, HIV, all sorts of autoimmune diseases.
Lyme can cause fever, chills, headache, fatigue, weakness, and even vomiting, all within hours or days of being bitten. It can also cause a distinctive rash at the site of the bite, but that rash isn't always present. The symptoms often seem like those of a cold or flu, and many doctors dismiss patients with a simple explanation. It's the summer flu.
Coming down with flu-like symptoms in the middle of summer, and nobody else in the community is getting the flu, then it shouldn't be presumed to be the flu. In fact, nowadays, with the evidence that we have, Lyme disease should be at the top of the list.
But in many cases, that's not happening, meaning Lyme is going undiagnosed or misdiagnosed.
That absolutely concerns me, that they could be being misdiagnosed and not treated, and hence not reported.
If caught early, a course of antibiotics usually kills the bacteria. But if left untreated, Lyme can continue to percolate, leading to even bigger health issues.
Once you miss the opportunity to treat it acutely, and then the bacteria can disseminate from the site of the tick bite, and it can spread to your joints, can attach to the muscle of the heart and the nerve conduction system of the heart.
Mr. President,
celebrities like Alec Baldwin, Shania Twain, and Avril Lavigne have struggled with it, and it's thanks in part to them Lyme is getting on the radar.
Disease. They don't have an answer for them, so they tell them, you're crazy.
Many doctors don't even know the symptoms, and the medical community still doesn't have a completely reliable test either.
We know that the current diagnostic tests for Lyme disease are insensitive very early on in the disease.
Mary Beth Pfeiffer is an investigative journalist from the U.S. who started to notice many people in her community getting sick, so she decided to investigate. What she found was alarming, and she says it's likely also the first disease directly attributable to climate change.
There's very little doubt that we ourselves as a society and as a species have really fomented Lyme disease. And climate is one of the prime ones.
She also noticed a massive difference in the amount of research and funding for Lyme compared to other diseases, and believes this is part of the reason it remains underfunded, undertreated, and dismissed by many healthcare professionals.
The number of clinical trials that have been done for AIDS number about 11,000. You look up clinical trials for Lyme disease, there's about 60.
And doctors who do treat and study Lyme say it's time for the medical community to catch up.
We have to educate physicians and healthcare workers regarding Lyme's disease.
So what do you do to protect yourself? Well, if you're out for a walk in grassy or wilderness areas, make sure that you're wearing long sleeves, long pants, and socks with your shoes. The other thing you can do is spray some bug repellent. And if you do find a tick, be sure to get it off quickly. Although Lyme disease is finally starting to get attention, those who have suffered and those treating Lyme patients agree that there is still a long way to go, and for now, prevention is the best defense.